right upper. I don't care where you, well, let me back up. Before I start listening, I'd ask my patient, do you have any pain in your belly? Do you have any pain in your belly? When was your last bowel movement? She's like, yeah.
This morning.
Okay. So you ask your patient that. If she says, yeah, I'm having some discomfort over here, that would be the last area, okay? Wherever they're having pain, that's the last area you should be listening to or touching, okay? Because you want to do a comparison and see what you're hearing here. These would be the normal areas. There's something weird going on over here. That's the last area you listen to, okay? All right. So we got right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. Okay? I've listened. I would listen for a full 5 minutes before stating the patient has absent bowel sounds. Okay? Absent bowel sounds is an emergency. That's not normal. So before you go calling a doc and saying there's absent bowel sounds, make sure that you listen at least for a full 5 minutes. Okay? So a full 5 minutes. All right. What is this? Okay. All right. Okay. I've listened, and now I'm going to palpate, okay? You're not going to do deep palpation. You're not looking for borders of organs, okay? You're just looking to see if she has any tenderness, and you're feeling for any type of, any nodules, any swelling, any distension, those types of things, okay? So please don't go deep. You can use 2 hands if you like, or you can use 1 hand. It's up to you, okay? I use 1 hand. You do what's comfortable for you, okay? So then I go into my quadrants, okay? Right upper quadrant, okay? And it's not this, okay? It's I'm rolling my hand, okay? Right upper, right lower, left lower, left upper. Okay. Okay, all right. I'm done with the abdomen, okay? Now I'm going to have her bring her legs around to the side of the bed. Come over here. Let me let your legs sit. If your patient can't get up, they're weak or whatever, you can lower the head and have them roll on their side, okay, to assess their back. Okay, make sure your patient is stable. Once your patient is stable, you can come around. As I'm coming around my patient, I'm noting posture. I'm noting shape of the chest. I'm looking to see if there's any abnormalities. Is there a funnel chest? Is there a pigeon chest? Is there lordosis? Lordosis being that deep, where they really have that deep curvature of their spine. I'm looking for kyphosis, that hunchback looking thing. Okay, I'm looking shape, symmetry. I'm looking position, posture. Okay, I'm coming around, looking at the chest. As I'm coming around, only until I can come around to the back, you can assess a little bit for scoliosis if it's severe on the side. If they have severe scoliosis, you can see over there, but really you need to be behind them, and you're noting scoliosis. I'm checking the vertebrae for the scoliosis. Okay, I'm looking at my bony prominent areas. Okay, cervical, scapula, coccyx area, any redness. If I note redness, I'm going to try to blanch it. If I push on it and it turns white, then that means there's circulation there. You release, it turns red. If I push on it and it stays red, that's a stage 1 ulcer. Okay, so I look in the bony prominence coccyx area and I press. I'm looking for any edema as well. Okay, I've looked. Once I'm done, I'm going to go ahead and I'll start listening. You will not hear bronchial sounds from the back. The only place you'll hear bronchial sounds is right here at the trach. Okay? So we start bronchovesicular. 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 Vesicular. Vesicular. And you don't have to have your patient breathing. I just want to know that you know the landmarks. Okay? I'm done with the listening. Okay, go ahead and come on back. Lay back down. starting with upper extremities.
What's wrong with me? Paranoid now.
Upper extremities. What am I doing first?
Inspecting.
I'm inspecting. So I'm looking. I'm looking at the color. I'm looking for scars, any discoloration. I feel for moisture, the temperature. I check edema. You should know your scales. If it's a 1+, it's a 2 millimeter. If it's a 2+, it's a 4. If it's a 3, it's a
6.
Okay, it's a 4. It's a
8.
8, or it's hitting edema. So I'm checking for edema. I'm doing a comparison. I'm looking to see if one is bigger than the other. I'm going to check circulation. Bilaterally, I'm checking radial pulses. Noting rate, rhythm, I think volume. Okay. I'm checking capillary refill. I think your book has it like less than 2 seconds in the book, but on the floor it's usually less than 3 seconds. But I'm checking capillary refill. Okay. I'm checking strength. I need you to go ahead. You're going to do 2 strength exercises. Go ahead and squeeze my fingers, please. Okay. Palms facing up. I'm going to push down. Resist me. Okay. And go ahead and push down on me, please. And you should know the strengths. There's a scale as well, so that you can tell me what the strength is of your patient. I'm checking skin turgor, checking for tenting as well. And I'm going to do 2 range of motion exercises. When I do range of motion exercises, I'm assessing mobility of the joints. Okay? So palms facing up, and flex your arms into your chest, and extend. Flex in, and extend. Palms facing down, palms facing up, palms facing down, palms facing up. Okay, that's 2 range of motion exercises. You go to the next. Okay, I think I did everything for the top. Okay, I'm done with the upper extremities. Now I'm moving down to the lower extremities, and again I'm
Inspecting.
I'm inspecting. And the same thing I looked for in the arms, I'll look for in the legs. I'm looking for symmetry and see if one is bigger than the other. I'm looking for edema. I can check for turgor, moisture, temperature, scars, wounds, tattoos, anything like that. I'm going to check my pulses. I'm going to take your shoes off. Okay. Checking dorsal pedal pulses. And you look for the big toe, and in between the big toe and your second toe, you go right in between, and you're going down, and that's where you should find your pedal pulses, okay? I'm checking post tips. So you have this big ankle bone that sticks out, you go from the ankle bone, and you slide your fingers back, and there's like a groove right there. I'm checking post tibial pulses. I'm noting rate, rhythm, volume. Okay, capillary refill. I'm checking the heels for any skin breakdown. I'm going to check strength. I need you to push on my hands, please, and bring your toes towards you. 2 strengths, and I'm going to do 2 range of motions. Go ahead and flex your leg into your chest and extend it out. Flex it in again, please. Extend out, flex again. Extend out. I need you to rotate your right foot clockwise and counterclockwise. Left foot clockwise, counterclockwise. Okay, 2 range of motion exercises. Range of motion exercises are in your book, so you don't have to do what I just did. Look in your book and get 2 range of motion exercises. Okay? I believe that's it. Last but not least, I'm going to come up with a Braden scale score. There are 6 different areas in a Braden scale score. You should be familiar with it. It's like nutrition, mobility, ambulation, moisture, shear and friction. I think there's one more. I can't remember what it is. There's 6 different areas. You come up with a score based on those 6 different areas. Are they eating well? Do they require you to keep pulling them up in the bed? Are they mobile? Are they bed fast? Are they chair fast? You'll come up with a score. The max is 23. And you'll tell me, based on the information that I received from the patient, brain scale score of whatever. In this case, she would be a 23, it's a max. Okay? I think that's it. Any questions? Any questions?
Her radio checked off on this today.
No.
Oh, no, please.